When we talk about healthcare, what do you think of? Doctors, medicine, and hospitals? But the future of healthcare is going to be a lot more different. Many technologies will disrupt this industry. For example, robot doctors, programmable cells, organs on a chip, 3D printing medicine, and medical Internet of Things. First, let's talk about robot doctors. Today, several vital testing can be already done with your iPhone, and similarly in the future, a lot of doctors could be replaced by machines and robots. What is the reason behind this? First, machines and robots are improving their skills much faster than doctors. Second, robot doctors don't forget anything about patients. What's more, in a lot of cases, robots have a higher rate of success in making the right diagnosis than real doctors. And robot judgment don't suffer from any psychological bias. What are the impacts? Patient expectation toward their doctors are going higher. Average skilled doctors would be first impacted. 90,000 people currently working in hospital in UK could lose their jobs due to robot doctors. The second disruption we'll talk is programmable cells. Aging is the major risk factor for diseases, so understanding the aging process could have impacts to elevate diseases. Programmable cells is the technology to hack the cell's algorithm to control the process and give the cells capabilities to fight diseases and even to solve the aging problem. What is the impact of programmable cells? It could detect the disease more accurately. Second, we could have more appropriate medical curing process. It provides us probability to solve the aging problems. Just imagine, if we have this kind of technology, we could even be X-Men. The next disruption we're going to talk today is organs on a chip. Traditionally, we test drugs on this. But imagine we can test on this. This technology is called organs on a chip. An organ on a chip is a multi-channel 3D microfluidic cell culture chip that simulates activities, mechanics, and the physiological response of entire organs and organ system, a type of artificial organ. Organ on a chip will impact the pharmaceutical company in several profound ways. First, it's going to bypass animals. 150 million animals are used in lab experiments each year, but many of the testing animals will not predict how long the drug will affect humans. Second, it speeds up the development of drug. Instead of trying years on animal, you can identify the problem much earlier. Third, reduce the cost of development of drugs. And the last, lead to the personalized drug. You can inject your own cells into the chip, so the drug will treat your disease more effectively. The fourth disruption is 3D printing. 3D printing has become a useful and potentially transformative tool in a number of different fields, including medicine. Just imagine what we can do with 3D printer. You may find impossible is nothing. 3D printer could print tissue with blood vessels, low-cost prosthetic parts, drugs, tailor-made sensors, medical models, bone, heart valve, ear cartilage, medical equipment, cranial replacement, synthetic skin, and organ. There are several benefits to impact the patients and hospitals with 3D printing medicine. First of all, the greatest advantage that 3D printer provide in medical application is the freedom to produce custom-made medical products and equipments. Second, 3D printing could produce items cheaply. Traditional manufacturing methods remain less expensive for large-scale production. However, the cost of 3D printing is becoming more and more competitive for small production runs. Thirdly, fast in 3D printing means that a product can be made within several hours. It could reduce lead time. What's more, 3D printing is the democratization of the design and manufacturing process. Our fifth disruption for healthcare is medical Internet of Things. Medical Internet of Things integrate the physical and digital worlds through object of network connectivity in the healthcare industry. It transforms raw data into simple, actionable information and communicate with other objects, machines, or people. It can be leveraged to improve access to health, quality of care, consumer expense, and efficiency. There are several impacts. To the healthcare provider, it improves response speed, reduce the need for unplanned hospital admission or GP visits, lower network-connected devices than traditional hardware. To consumers, people are looking at how to integrate things like Fitbits and other fitness devices to bring patients' provided data into healthcare analysis. We believe these 5 disruptions will change the future of healthcare. The company we're going to talk about is Sanofi. We'll talk more about the company next time, and see you next presentation.